Hi, this is Sharon Paulia. Today I'm going to continue on with our electronic medical record course. This is Module 3, and today we're going to discuss patient demographics. Demographics are an important part of any electronic medical record. The demographic screens I'm going to be showing you today come from Open EMR. So to some of you they may look very familiar. I want to just go over some of the screens and some of the fields that are important to collect on an EMR, specifically Open EMR. So once you click on a new patient, the demographic screen, the new patient up here, the demographic screen will appear. From the search screen down here, you can enter in a patient's name, last name, or comma first name, and it will either find the patient or not find the patient. Either way, whatever you enter within the search will now carry over to the demographic screen. So for this example, we're going to show that we had typed in Theodore Smith and with a date of birth of 9/30/1988, social security number, it's a male, single, and it came in under the Who tab on the demographic screen. The next item we want to talk about is entering contact information. So we determined who the patient was, and now we see a patient. The patient's name is up here, their name, their date of birth, their sex, and their age. Now we had already filled in the Who tab. Now we're up to the Contact tab. So here we're going to capture contact information, address, city, state, zip code, emergency phone number, mother's name, any information that is pertinent to the patient. On the screen, we can also capture insurance information, the primary insurance, but I will discuss this a little later as well. I just want to touch on this. Primary insurance, you want to put how the insured is related to the insurer, and the name of the plan and the policy, and all the other information captured on this screen. Okay, following along the top tab, again under the demographic screens, we had done who the patient was, we had already filled in their contacts. We're now going to talk about communication information. So here we're capturing some pertinent information: the provider, who the doctor is, the pharmacy. This is important when we want to do our e-prescribing, so that when we e-prescribe a prescription, it knows which pharmacy to send it to. A HIPAA notice, that's important to collect notifications. So here you're just documenting that you have collected, that the HIPAA notice, it was received. There's also a place to allow emails if the patient wants to be communicated with via email. If we can allow access to the immunization registry, likewise allow access to the health information exchange, and whether the patient wants access to the patient portal. The patient portal will only be set up in Open EMR if this is set to yes. Also, there's a field to allow for immunization data sharing. Next, again, we're continuing along the top tabs. We had just finished the communication information. Now we're going to capture employer information, if in fact there is employer information. Here we're going to capture the patient's occupation, the employer or employers, the address of the employers, and this is usually pertinent for insurance reasons as well. Next, again, we're continuing across the demographic tabs. After employer, we see the statistical information tab, and here we're capturing such fields as patient language, ethnicity, race, family size, income, if they need an interpreter, and what their referral source is. I'll get into why these fields are important. Some of them are for reporting purposes, and as I mentioned before, when we attest for meaningful use, fields like language and ethnicity are required. Okay, this last tab is called miscellaneous information. This is kind of interesting because this is where we capture deceased information. If a patient is deceased, we like to capture the date and reason, and this is so that we don't end up sending notices out to deceased patients or upcoming appointments or anything, that can be viewed as, inappropriate. For the next few screens, I just want to review and highlight the screen, what we captured and why we captured it. So in open EMR, we capture patient demographics. What are patient demographics? There's primary information such as name, date of birth, sex. We also capture marital status and contact information. This is important to be able to communicate not only with the patient or family members for results and for scheduling reasons as well. Continuing on, I just want to again highlight, what patient demographics are and what's captured. We had mentioned the primary information and the contact information. We also capture the primary provider. We like to capture that HIPAA information. It's important that this is collected. Again, the language and ethnicity, insurance coverage. Of course, this is important for billing reasons. And as I just mentioned, we track, deceased patients as well. And you might want to ask yourself, why are demographics important? Well, it's important because when a patient comes in, you want to be able to search for that patient. As the saying goes, garbage in, garbage out. You want to be able to do a minimal search, like just a few letters of the last name, and a few letters of the first name, so that several patients, if they have the same name, will come up, but you'll be able to pinpoint which is your patient, so you'll be able to match on name, sex, date of birth, social security number. For instance, like I stated here, you put in John Smith, you can get 100 John Smiths coming up. If you document on the wrong one, then you have two EMRs with the same, same information, bits and pieces. That becomes more work. So you'll need to correct one, delete one, or merge the two records depending on the system. So it's very important to do a proper search and to have correct information in there. And again, continuing on as to why demographics are important. One is for reporting reasons. We report now to a lot of government agencies. It's important to have correct patient demographic information. CMS, Medicaid, Medicare, when we're testing for meaningful use, as I had mentioned before, patient demographics is one of the fields that's captured, and it's one of the reporting items for meaningful use. So it's very important to have that information in there, aside from the patient name, date of birth, also the language and ethnicity fields as well. Demographics help in the delivery of care, and they help raise patient satisfaction surveys. It's important to send out the survey, so you want to have the correct information to be able to collect data on patient satisfaction as well as to improve patient satisfaction. And lastly, I just want to mention billing. Again, very important to have correct insurance information, that all the demographic information is correct so that we can bill correctly. Okay, thank you very much. It's the end of this module.